Good afternoon, everyone. We hope you're having a wonderful day. My name is Lindsay Abramo.
I'm Rachel Archambault.
My name is Gonzalez.
And I'm Emily Schapiro.
And today we will be discussing how we will be using the EBP decision-making process.
All right. So today we will be addressing the scenario we were given for Dylan. Then we will summarize the article using the 7 EBP questions, and finally we will discuss how we came to the conclusion of using this article.
Alright, so this is our scenario. Dylan is a 12-year-old 6th grader who struggles with decoding and reading. His word recognition is at the 2nd grade level. When he reads orally, he struggles with phoneme graphing correspondence. What might you do to help him?
So question 1, have studies been done that address your area of concern? If so, what did you find? So studies have been done regarding orthographic rhyme and grapheme phoneme correspondences. The researchers found that children struggling with decoding have an increased understanding when taught letter-sound correspondence rather than whole word approaches in reading.
So this article was written by Christensen and Bowie and was published in 2005. This article, in it, they discuss the efficacy of different approaches in teaching decoding skills. The study compared orthographic rhyme, which is a word family's approach, grapheme phoneme correspondence, and implicit phonics. Both orthographic rhyme and grapheme phoneme correspondence are considered explicit phonics. Studies have been conducted in the past to compare explicit and implicit methods, but this study went one step further since they compared 2 explicit methods. Okay, question 2. How well do the studies relate to your specific question and student? Our student who's struggling with decoding and reading and word recognition in phoneme grapheme correspondence can be defined as dyslexic. Our study was meant to help those with grapheme phoneme correspondence just as Dylan does. The orthographic study is looking for the best method to improve decoding skills and reading for those who may be labeled as dyslexic. The average age of the student was 7 years and 1.5 months, with the lowest being 6 years and the highest was 8 years old.
Alright, so how convincing were the findings of this study? The article used a complete review of literature to discuss the advantages of grapheme phoneme correspondence training as well as orthographic rhyme. Through their own study, they found that grapheme phoneme correspondence was more beneficial. We consider this a level 1B, a well-conducted, single randomized controlled trial, because the sample size was over 30 for both experimental groups and the students were randomly assigned to each of the groups.
So, although Dylan is a 12-year-old 6th grader and the study was done for 2nd graders, we feel as though the study would be beneficial because he is reading on a 2nd grade level. The only issue with Dylan's age in the study is the intervention was done in class. Dylan would have to receive intervention in a specialized setting, so he may have higher level words than a 2nd grader would receive. Another factor that may need to be considered is the student's motivation to complete the intervention. If Dylan is unwilling to work during therapy to meet his goals, it would be like the old saying, you can bring a horse to water, but you can't make him drink. The SLP may have to show Dylan why he should be motivated to work towards completing these goals by showing how it can be meaningful for him. Another factor that would need to be considered is if Dylan has any other deficits or disorders. The study only discussed students that were struggling with their decoding skills. If Dylan has another disorder or a deficit that is comorbid with his decoding and phoneme graphing correspondence, then that may impact how effective the treatment is for him. We should also look at the family and environmental aspects, such as if the family is supportive of Dylan's reading acquisition at home, and some cultural background to see if there is any factors in there that can contribute to Dylan's being below average reading level.
Okay, so what is the best choice considering hard data and other factors? Based on the results of the study, grapheme phoneme correspondence training was more beneficial for students than orthographic rhymes or implicit phonics. Therefore, Dylan should receive individualized help for grapheme phoneme correspondence to improve his decoding skills in reading. Table 4 describes the means, standard deviations, and results of the analysis of variance for each instructional condition.
Table 4. This slide shows Table 4 as stated previously, which shows the results of the study regarding grapheme phoneme correspondence, orthographic rhyme, and implicit phonics. As you can see, GPC or grapheme phoneme correspondence had the best results overall. In each of the categories, such as program words, accuracy, and speed, the mean was high with a low standard deviation compared to orthographic rhyme or implicit phonics, which had a standard deviation of 112.04 and 134.09 respectively.
All right, was the decision a good one? If so, how do you know? Based on the results of the test, those who encountered grapheme phoneme correspondence had an increased level of decoding abilities in reading rather than those who only had implicit phonics training. If Dylan were to receive training for the grapheme phoneme correspondence, we feel that based on the results of the study, his understanding would also improve. If we were to work with Dylan, we would give him a preliminary test of grapheme phoneme correspondence to show his current level, 2nd grade. Through interventions and working on grapheme phoneme correspondence rather than orthographic rhyme or implicit phonics, we would be able to see Dylan's level of understanding in reading increase. We would then give him the same test administered in the beginning to Dylan. We would then give the same test administered in the beginning to Dylan once again after 2 months to see if there was an increase in reading level.
Question 7. How are you doing with the evidence-based practice process? Well, we feel that the evidence-based practice process was extremely helpful in showing us what future research would be based on. The study showed the importance of using previous used research to formulate a study that could be more beneficial than research in the past. The evidence-based process also allowed our group to make sure that we were finding an article that would include treatment appropriate for Dylan and his needs. The guiding questions allowed us to reflect on what the implications were for each study. One area that we really focused on was question number 2. We read many articles about preschool age populations and the interventions used for them. As we mentioned previously, Dylan was a 6th grader who was 12 years old, so not exactly that preschool population. And in those studies in the preschool population, they were covering single letter decoding, which was not relevant to Dylan. So this is why we had to find some other studies because we weren't trying to compare him to a preschooler. If we wouldn't have compared our client, Dylan, to the research, we may have found an intervention that would have been considered inappropriate for our client.
All right, so we chose this article out of all of the other ones that we looked at because it seemed to be the best fit. The study concluded that using grapheme phoneme correspondence training yielded the highest results over orthographic rhyme or implicit phonemes. Also, because Dylan is struggling with grapheme phoneme correspondence and is only up to 2nd grade level, the study aligns well considering the study was done for 2nd graders. The only thing that needs to be changed is a higher level of words that are still on the 2nd grade level, so Dylan does not feel bored or embarrassed of his reading level.
And our post organizer today. Today we explained to you the situation that our group faced while we were using EBP as a decision-making model. We also discussed what article we decided to evaluate with this model. Based on the article and the scenario we were given, we explained each step of the decision-making process that we underwent to ensure the intervention described would be appropriate for the client. And this is our reference by Christensen and Bowie.